Good afternoon. My name is Michelle Brunson. I'm a Health IT Advisor for the Telligen Quality Payment Program Resource Center. Presenting with me today is Susan Brown, our Resource Center Director. Today, Susan and I will introduce a new program called QPP-SURS for Small, Underserved, and Rural Support, and how this free support is available to help small practices with the quality payment program. After her portion of the webinar, I will present the basics of the quality payment program.
Thanks, Michelle. We've designed our webinar today in two parts. Part one will cover technical assistance options for the quality payment program, and part two will provide a high-level overview of the quality payment program. And we've designed the webinar this way because we know that many of you have already participated in a number of events related to the quality payment program and may not be as interested in the second portion of the webinar. So again, the first part will focus on technical assistance options. After the first section, we will open the lines for Q&A. And then if you wish to sign off at that time, feel free. We do invite you to stay on for the whole webinar. And section two will be the quality payment program at a glance. So thank you again for joining us today. My name is Susan Brown, and I'm the Director of the Telligen QPP Resource Center. And we would like to cover several different resources that are available for practices for you to obtain technical assistance related to the quality payment program. And you will see that CMS is providing a number of options. So there are many open doors for you to receive technical assistance. You will see the national resources provided by CMS. We're going to be covering these on subsequent slides. The Transforming Clinical Practice Initiative, or TCPI, the QIN-QIOs, as well as the newly released program, the QPP-SURS. This is a graphic that was released by CMS that displays all of these technical assistance options, and we really like this grid because it shows the broad range of offerings from CMS to support your practice with the quality payment program. And I'm going to start in the lower right portion of the grid and just explain each section of the grid, and then on subsequent slides, we'll delve into each of these sections individually. So starting in the lower right, this is the technical support that's provided by CMS nationally to all providers and clinics. And these are things like the CMS QPP website, which we constantly refer folks to because it's such a valuable resource, qpp.cms.gov, as well as the service center that they have established with both a phone number and an email help desk, and learning networks for the advanced alternative payment models. So again, lower right portion of the grid are the national support options offered by CMS. The upper right portion of the grid represents the small, underserved, and rural support centers. So this becomes the acronym SURS, or QPP-SURS, which are the resource centers for small practices of 15 or fewer clinicians. In the lower left portion of the grid, you will see the QIN-QIOs, and these organizations support organizations with over 15 providers. And every state has a QIN-QIO, and there's a link in this grid to help you find the QIN-QIO that serves your state. And then lastly, in the upper left corner of the grid is the Transforming Clinical Practice Initiative, or TCPI, which you may also know as the Practice Transformation Networks, the PTNs, or the Support and Alignment Networks, the SANs. And again, every state is served by PTNs and SANs. And this technical assistance option does not put a limit on the size of practice that can enroll. so small and large practices can enroll in PCPI, and they provide QPP support, but their scope is broader in nature, and we'll discuss that on a subsequent slide. So again, that lower right portion of the grid, what is available from CMS nationally to support your practice with the QPP program. I mentioned this website, qpp.cms.gov. We here at Telligen, we love this website. It's very user-friendly, it's acronym-free, and it's constantly updated with new program information. So if you haven't been there yet, please check out qpp.cms.gov. CMS has also established a national support center to assist with your questions. And again, we here at Telligen have personally used this to submit our own questions about the quality payment program, and their response time is excellent. So please reach out to qpp@cms.hhs.gov or call their 800 number to initiate an inquiry. And the last level of support are the learning networks offered for the advanced alternative payment models, and we've included a link on how to look into those learning networks. Next, that upper right portion of the grid that I referenced earlier is QPP-SURS, and this is the program that Michelle and I are representing today, so the small, underserved, and rural support centers. These were recently awarded just only 2 weeks ago, February 16th. There were 11 organizations awarded. Telligen was one of those. And so every state has an assigned QPP-SURS contractor to provide support for the small practices. And these are free to the practices and clinicians. There is no cost. I also want to point out there is no enrollment process at this time, so you do not need to officially sign up to use the QPP-SURS centers. You can simply reach out to their designated contact person, email, or phone number and submit your inquiry. So again, you don't need to formally enroll to use the services of the QPP-SURS. And QPP-SURS is designed to serve the solo or small practices of 15 or fewer clinicians, and our highest priority focus are those practices in rural areas, health professional shortage areas or HPSAs, and medically underserved areas. So we really want to leave no provider behind in terms of supporting you in the Quality Payment Program initiative. What types of services will QPP-SURS provide? Our main focus is outreach, so making sure folks are aware of the QPP program and the deadlines, the payment adjustments, and any associated penalties. We want to provide expert guidance on how you can succeed in the QPP, and we have staff available to provide direct technical assistance. So for example, we can assist you with selecting and reporting the appropriate MIPS quality measures for your MIPS score. Remember that MIPS quality measures account for 60% of your score in 2017, so it's important that you select those carefully. We can help you with selecting and reporting your improvement activities, also known as CPIAs, Clinical Practice Improvement Activities. We can also assist you with health IT optimization, so how to get those quality measures out of your EHR and how to understand and meet the goals of the Advancing Care Information component of MIPS, the former Meaningful Use. We can support you with strategic planning at your organization related to the Quality Payment Program and change management processes. And we can also help you evaluate options for ultimately joining an advanced APM. So within the Quality Payment Program, there are two tracks, the MIPS and the APMs. And at some point, if you are wishing to, quote, graduate from the MIPS side and move over to the APM side, we can help you evaluate that process. This is a nice map that CMS released about the QPP-SURS awardees. So you can see the 11 contractors that were awarded in the light blue box over to the right. And you can see that Telligen in the light green will be working with the states of Iowa, Nebraska, North Dakota, and South Dakota. So if we hear from practices that are located in another state, we will attempt to do a warm handoff of that practice to the appropriate contractor in their state. And we've already begun conversations to get to know our neighboring QPP-SURS centers so that we can achieve that warm handoff efficiently. Our entire focus of this program is excellent customer service. So anyone who calls our QPP-SURS Resource Center, we not only want to direct them to the correct resource, but try to do so in an efficient fashion and in a warm handoff manner. This is another grid that was released by CMS that has contact information for each of the 11 QPP-SURS centers. And I neglected to mention at the beginning of the call that these slides are already posted on our blog site, TelligenQPP.com. So again, after the webinar, or even now, you can go to TelligenQPP.com, and you can find a copy of this slide presentation if you want to access some of these links or review the information. The Telligen QPP-SURS Center will assist practices in the 4 states listed under Bullet 1, which I've already mentioned. And if you contact us, you will receive a point of contact through our organization that will help guide you through your QPP journey. We are offering a help desk during normal business hours, and we do operate under Central Standard Time, so that is available Monday through Friday, normal business hours. Starting March 28th, our QPP-SURS Center will be offering office hours on Tuesdays from 9 to 11 a.m. and Thursdays over the lunch hour, 11:30 to 1:30. And so if you want to note those times, you can be assured if you call during those times, you will be able to speak to a live advisor, QPP advisor. Again, that's starting March 28th. If you fill out a form on our blog site, you will receive a monthly newsletter from us that includes timely program updates from CMS, as well as Telligen QPP-SURS, and this will be delivered directly to your inbox. And we are also offering specialized access to expertise on health IT questions, patient-centered medical home, behavioral health, and financial issues related to the MIPS formula and advancing on to an alternative payment model. So we are open for business, and we want to hear from you. We have received many inquiries since our February 16th award date, and we love hearing from clinics, understanding what their needs and questions are. So please reach out to us. Our 800 number is provided here. We also have an email inbox, QPP-SURS@telligen.com, and our blog site that I've already mentioned, TelligenQPP.com. This is kind of a bare bones site at the moment. It currently houses our calendar of events and has updated contact information, but we hope to grow the content over time. This is also where you can find today's slides at TelligenQPP.com. Telligen is not alone in this effort. Thankfully, we've engaged some wonderful partners, and some of them are probably listening in right now. But Telligen is the prime contractor for our QPP-SURS team, so we provide centralized support as well as cover the states of Iowa and Nebraska. One of our partners is the Medical Group Management Association, or MGMA, and they are our financial subject matter experts So as we receive questions, for example, on revenue cycle management and the attributes of the QPP formula, we can engage our experts at MGMA. Another partner we're really excited to work with is HealthPoint of Dakota State University. They were a former Health IT Regional Extension Center, so we've worked with them in the past. And they will be the primary points of contact for our North Dakota and South Dakota region. And our last partner is Best Practices Academy, and they serve chiropractors in the upper Midwest. So we're excited to be able to funnel specific questions about chiropractic involvement in the quality payment program to Best Practices Academy. They also have subject matter expertise on your questions related to behavioral health and patient-centered medical home. So we are excited about this great team we've put together to serve you in the best manner possible. And again, our primary focus is providing excellent customer service. We may not be able to answer your questions immediately as they come in, but we assure you that we will do our best to resolve things as quickly as possible, and we won't leave any issue unresolved. Okay, so moving on from QPP-SURS, I just wanted to mention again that the QIN-QIOs are available to support your organization on your QPP journey. There are 14 QIN-QIOs nationally, and their focus is supporting the large practices of over 15 eligible clinicians and ACOs. Again, they are available at no cost to clinicians, and their primary focus is on improving patient safety, healthier communities, reducing hospital admissions, improving quality. But they do have subject matter experts on the quality payment program. They provide a lot of great resources in terms of a weekly digest and coffee talk discussions. So we want to make sure you are aware of this valuable resource. And in our QPP region, Telligen is the QIN-QIO for the state of Iowa. And I want to give a shout out to our other QIN-QIO that covers Nebraska, North Dakota, and South Dakota, Great Plains QIN-QIO. We have already been in discussions with them. They will be an excellent support on this work as well. And they have a very user-friendly site that you can access for quality payment program questions for those large practices. And it's greatplainsquin.org/initiative/QPP. greatplainsquin.org/initiative/QPP. And they have done a great job of getting that set up, and they are ready to take those large practice questions about the quality payment program. And lastly, the Transforming Clinical Practice Initiative. And as I mentioned earlier, this initiative might be known to you as the PTNs, the Practice Transformation Networks, or the SANs. And this initiative is another CMS program that can provide QPP support, although their goals are broader than that. And they can take any size practice, primary care or specialist, who wants to work on moving through 5 phases of transformation. So they're looking at overall organizational transformation, not just preparedness for the quality payment program, although the end goal is that these participants would thrive in a value-based purchasing environment. Every state has multiple PTNs and SANs. Telligen, for example, works with the Compass PTN, which covers all 4 states in our QPP-SURS region, but there are other PTNs and SANs available to providers in our 4 states. This, again, is a no-cost program. If you join it, you will be assigned one-on-one support from a quality improvement advisor and also have access to very valuable faculty and peer-based networks. So that is a summary of the broad range of technical assistance options available to you through these various CMS initiatives. And we're going to open the line because that includes the first section of the
The
webinar.
leader has
If there are
unmuted
any
your line.
questions specifically related to technical assistance support options. And Marlene, you can tell us if anything is coming through the chat. If you do have a question, remember to unmute your line if you muted it by pressing pound 6. Okay, we'll wait another 10 or 15 seconds, see if there are any questions. Okay, not hearing any. If you do come up with a question, feel free to enter it into the chat or just email that QPP-SURS@telligen.com and we will get back to you. And at this point, I'm going to turn it back over to Michelle, one of our lead.
The leader has muted your line. To unmute your line, press pound 6.
Payment program itself. So, Michelle.
Thank you so much, Susan. And thank you to everybody for attending today. I want to cover some high-level information again about the Quality Payment Program. And even though you may have heard this before, maybe one time, maybe many times, it's always nice to have a refresher if you're like me and just help drill that down a little bit more for you. So the next part of this presentation with a high-level background, I want to begin with a brief overview of the origins of the Quality Payment Program. This stems from the Medicare Access and CHIP Reauthorization Act of 2015, or MACRA. This was a bipartisan piece of legislation that passed by huge margins in the Senate, 92-8, and in the House, 392-37. Congress passed the MACRA legislation to replace the highly flawed Sustainable Growth Rate formula, which ended 13 years of last-minute legislative fixes, also known as doc fixes, to the statutory requirements that would have reduced fee-for-service Medicare payments to clinicians by more than 20% in the coming years. Those who practice medicine and care for our beneficiaries were fearful of these looming reductions to Medicare payments. The QPP strategic goals are listed here, and as you navigate through the Quality Payment Program, it will become very apparent that CMS kept these goals in mind, trying to keep the patient in the middle of all of it with the goal of improving their outcomes. There are many options and flexibility throughout so that you can tailor the program to best fit your practice's needs. The QPP website, again, is listed here that Susan mentioned, and we just can't say enough how helpful this site is and how many different types of tools CMS has posted and will continue to post on this site. We think this is an important slide to talk about how the strategic goals benefit both the patients and the clinicians. With patients at the center, the goal is that through increased access to care as well as patient-centered approach, they will have improved results. And there are two words that keep coming to mind in what CMS has done with the Quality Payment Program: streamline and align. Whether it is how you report, what you report, time saved on reporting, or how you are reimbursed for quality. The Quality Payment Program creates a payment method that promotes the quality over volume by transitioning to this new payment system promoting the high-quality, efficient care. And it streamlines the legacy programs of TQRS, or Physician Quality Reporting System, Meaningful Use, and Value-Based Modifier Program into one single quality program. In addition, it creates two choices for paths, either the Advanced Alternative Payment Model or the MIPS model. And finally, it provides incentives for worthy performance and a negative payment adjustment for lower performance. Again, aligning, streamlining, but also adding in flexibility all along the way. So the Quality Payment Program strategic goals will help reform Medicare Part B payments for over 600,000 clinicians, and it improves the care across the entire healthcare delivery system. Clinicians can choose how they want to participate in the Quality Payment Program based on their practice size, specialty, location, or patient population. There are two tracks again. The first track is the merit-based incentive payment system. This path allows you to earn a performance-based payment adjustment. And the second path is the Advanced Alternative Payment Model, or APM. And if you choose this path, you will earn an incentive payment for participating in an innovative payment model. So which path is right for you? We're going to start talking about the MIPS path first. And again, extra flexibility is built into this program on many levels, starting with which path you take. The first path we discussed here, the Merit-Based Incentive Program system, is replacing those three prior programs I just mentioned, the Physician Quality Reporting System, Value-Based Modifier, and the Meaningful Use. And eligible clinicians can earn their payment adjustment whether it's positive, negative, or neutral based on their performance compared to their peers. Each eligible clinician will receive a final score, and that final score is calculated from the data submitted by the eligible clinician in 4 performance categories. The payments for the 2017 transition year, if any, will be made in 2019. Who is included to participate in the Medicare Part B, or the MIPS program? So Medicare Part B eligible clinicians, or ECs for short, in 2017 and 2018 are from a number of different groups. But first, to be eligible, you have to bill more than $30,000 in Medicare Part B allowed charges a year and provide care for more than 100 Medicare patients. In addition to that, to be considered an eligible clinician, you have to be part of a group of providers. And the first group are physicians, and those are defined by the Quality Payment Program as an MD or a DO, a dentist, a chiropractor, a podiatrist, or an optometrist. Or the other types are physician assistants, nurse practitioners, clinical nurse specialists, or certified registered nurse anesthetists, or CRNAs for short. In 2019, there may be additional provider types that are added, such as dietitians, social workers, physical therapists, occupational therapists, for example. And most clinicians will participate in MIPS with the goal of ultimately transitioning to the Advanced Alternative Payment Model. So who is not included in participation? The groups who are not included in the participation are those who are newly enrolled in Medicare, or those that do not meet those low patient volume thresholds or low dollar volume thresholds. And so if you bill less than $30,000 in Medicare Part B charges, or if you see less than 100 Medicare patients, you would not be included in the MIPS and eligible for those payment adjustments. Those thresholds are measured at the group level for group reporting, if you are reporting as a group, or the individual level for individual reporting. And those that are significantly participating in the advanced APMs, meaning that you must receive 25% of your Medicare payments from the advanced APM, or see 20% of your Medicare patients through the advanced APM. That qualifies you to be considered significantly participating in the advanced APM and therefore would not be included in the MIPS program. Now, one thing to note is that MIPS doesn't apply to hospital-based or facility-based payment programs. It does apply to the eligible clinicians working in those facilities billing Medicare Part B, however. We could do a whole presentation, and there have been many on the MIPS performance categories, but because today I want to keep it at a high level basic information, I'm going to just let you know about the categories themselves and their weights for this transition year of 2017. First is the quality. And so there are, for the transition year of 2017, you will report on your quality measures that best reflect your practice goals, and you will report on 6 quality measures selected, one of which will be an outcome measure, or if there is not an outcome measure available, a high priority measure. And this is similar to the PQRS reporting, so if you've done that before and you have reported, you'll understand this quality measure a little bit more. And for this 2017 year, it does count for 60% of your final score. The second category is advancing care information, and this is what you might formally know as meaningful use, or the EHR incentive program. You will choose to report on 4 or 5 measures depending on the year your EHR was certified, either 2014 or 2015. There's a lot of flexibility compared to meaningful use, however, as there are no minimum threshold percentages. You just must have one patient that you report on, that you meet the measures and be able to report. Advancing care information counts for about 25% of your final score, or does count for 25% of your final score. The third category is new, and that's the improvement activities. And this is where eligible clinicians will select these activities, again, to match their practice goals with that flexibility in mind. And these improvement activities may focus on such things as improved access to care, population management, care coordination, beneficiary engagement, patient safety, or achieving health equity, as well as integrating behavioral and mental health, for example. Improvement activities count for 15% of your final score for 2017 transition year. And lastly, there is a cost category. Now, this will not be factored in for 2017, but clinicians will be provided feedback by CMS for the 2017 year. And beginning in 2018, CMS will calculate measures based on your claim. So which path is right for you? There's another path, and that is the advanced alternative payment model we've been speaking about. And this is going to be less common for the transition year of 2017. These payment models move away from fee-for-service with a greater opportunity for rewards because there is an increased risk. You must be in an advanced APM to participate, but you also must meet some minimum requirements, and we'll talk about those next. If you meet the thresholds for being in an improved advanced alternative payment model, you will receive a 5% lump sum bonus in years 2019 through 2024, and you also receive a higher fee schedule update from 2026 and beyond. The requirements for an advanced alternative payment model are listed here. First, the advanced alternative payment model must use a certified EHR technology. And next, they must collect similar quality measures comparable to those in MIPS. And finally, the advanced alternative payment model must either be a medical home model expanded under CMS Innovation Center authority or require participants to bear more than a nominal amount of financial risk. The list of those 2017 eligible advanced alternative payment models are included here. Finally, the extra flexibility doesn't end with the path or the measures you choose. CMS has allowed a system for clinicians to decide at what level they want to participate in the quality payment program for the transition year 2017 only. If you haven't done much reporting or for either the PQRS or meaningful use in prior years, you may want to start out with the easiest of the options for picking your PACE, and that is the test PACE. By submitting just one quality measure, or one improvement activity, or 4 or 5 required advancing care information measures, you will avoid this penalty. So you will not receive a penalty, and you will have either a neutral bonus or even potentially a small bonus. The next option is a partial year submission. And this is where you submit data for at least 90 days. If you aren't ready on January 1st, or you weren't ready, but you do want to submit more than just one measure, one improvement activity, or the 4 or 5 advancing care information measures, you can choose this option. And by doing so, you'll either receive a neutral bonus or a small bonus. And just the biggest thing is to note that you will not receive a penalty. You can start your 90 days anytime between January 1st and October 2nd to allow for the 90 days to occur. So if you started October 2nd, your 90 days would end then on the required December 31st. And finally, the other option is to report a full year of data. It's really the best way to earn the largest payment adjustment by submitting on all the MIPS performance categories. And those positive adjustments are based on the performance data on the performance information submitted. not the amount of information or the length of time submitted. So you need to report for the full year, and you would report your data by March 31st of 2018. Again, then, you can also participate in the Advanced Alternative Payment Model for 17, but one thing no one wants to have happen, and CMS is trying on every level to make sure it doesn't happen, is that you would not participate at all. They have allowed this flexibility to be such that they want to make this transition year 2017 as simple as possible by not only allowing you to just submit one measure, but also to provide free assistance no matter what your size. And so please don't choose that last option of not participating at all, because you will receive a negative 4% payment adjustment. So the key thing we want to leave with you is that we're all part of this quality payment program, whether it's you, CMS, our support teams, other clinicians, or the patients themselves, with one goal in mind is that we improve our patient outcomes. We're all in this together, and we hope that you'll find the assistance that you receive, whether it's from the QPP-SURS or the QIN-QIOs or the TCPI or CMS themselves. We're all able to help you in your journey with the quality payment program. And now I would like to open up the line to take any questions that you may have.
The leader has unmuted your line.
And please feel free to ask us questions. And then Marlene, if you would also let us know if we have any questions in the chat as well. And Susan and I will be available for those questions.
I do want to comment that this webinar was recorded. And so in addition to the slides that are available on TelligenQPP.com, we will post this recording once it has been completed. So you can find the recorded webinar on our blog site as well.
And don't be shy. Feel free to ask any questions you may have. I'm sure if you have that question, somebody else does as well.
I go ahead and move to our resources page. Again, we've talked about all of these things, but the CMS QPP National Contact Information, the QIN-QIO map, that organization for your state, the PTN map helps you connect with the PTN contractors in your state, and then the slides from today's presentation, TelligenQPP.com/resources. So not hearing any questions come through, I just want to thank you on behalf of Michelle and myself for listening in. We are very excited to serve you and to being your partner on this journey. We know you have many things on your plate, and our goal is to serve you well and help make this journey a little bit easier. So have a great afternoon. Thank you.